Hello everyone, my name is Sarone and I am a registered nurse. And this video is to educate viewers, specifically CNAs and PCAs, on administering intramuscular medications in a home health setting. IM medications for the group that I'm educating are typically PRNs. So before administering, it is important to review any indications for the medication and protocols. For this demonstration, I will be using the medication olanzapine, also known as Zyprexa, for my example. Olanzapine in its IM form is used to treat acute agitation in clients. Signs of agitation include restlessness, irritability, pacing, and grimacing like this lady here. As you get to know your client, you'll be able to identify their tells of agitation. For example, let's say a client is a little disoriented and becomes fixated on going outside at night. When you ask them what they want to do, they reply with, "I want to go outside." You suggest a movie or ice cream instead, but they are not redirectable. I would say, "Okay, let's put on our shoes and grab our stuff, but go prepare the olanzapine," because they don't know what they want to do outside and they are getting hostile, and I want to prevent any safety risks to me or the client. So Zyprexa or olanzapine is a powder medication that needs to be reconstituted with sterile water in order to be administered intramuscularly. Typical dosages are 2.5 milligrams and 5 milligrams. However, the vial usually comes in 10 milligrams. So it is important to read the label and reconstitute the whole vial even when just administering half the contents. Here is an example of an olanzapine label. It states to use 2.1 milliliters of sterile water to mix in the vial, meaning that once it is mixed or reconstituted, 1 milliliter will equal a 5 milligram dose. You should also note the time you prepare the mixture because it is only safe to administer for 1 hour. Each time you prepare the medication, you should mark it in the MAR and notify me, the registered nurse, whether the med is used or not. The medication should remain stored in the brown bag that it comes in and in a dark area to protect it from light. So let's get into the demonstration. I accidentally clipped out hand hygiene and donning my gloves, but I want you to know that using an alcohol-based sanitizer or washing your hands before putting on the gloves is best practice. I am using practice vials, but olanzapine is a similar yellow to the powder that I have. We start by uncapping the powder in sterile water. Then, using an alcohol swab, clean the tops of each for about 15 seconds. I will start with the sterile water and pull a little over 2 milliliters of air into my syringe to inject it into the sterile water vial. Remember, this needle is sharp, so it goes in easily and there is no need to stab it in with force. Also, I am not holding the vial with my other hand to stabilize it because I don't want to risk pricking myself with the needle. If you do poke yourself or drop the needle, tend to your wound, throw out the needle, and grab a new one. After injecting air in, I flip the vial over to fill it with a little over 2 milliliters of the sterile water. Since the needle is so long, I am pulling it out a little so I can draw the solution out as I pull back on the syringe with minimal air. Sometimes it is easier to drop a little extra and push the excess back until I get to the 2 milliliter line. Now I am injecting the sterile water into the powder medication. I found squirting it in little bursts while twisting the bottle around helps with mixing. This mixes up pretty easily compared to other drugs, so you don't have to swirl it for too long. I chose to keep the needle in the vial as I mix it up for simplicity and reducing contaminating risk. Once I see that there are no clumps or solutes in the liquid, I am drawing up the mixture. Since we are using the example of Zyprexa and my imaginary client has a PRN for a 5 milligram dose, well, according to the label, 5 milligrams equals 1 milliliter. So I am only going to draw up 1 milliliter of the solution. I like to fill my syringe, tap any air bubbles out, and push it back to a little over 1 milliliter before I take my needle out. The solution is pretty thick, so I am going to edit out some of the time I'm spending here. So if you see any like jerky motions, it's just me trying to clip out extra time. So now I am going to carefully cap the needle and push the syringe until I get to the 1 milliliter mark. This ensures that there is no air hanging out in the needle. I can also do a couple flicks to just try to float those air bubbles up. I was trying to find a way to have my needle cushion be on its side so I could mimic the deltoid muscle, but it wasn't working. So here is an image of the injection site of choice. There are others, but at this time I am not comfortable delegating an injection to these locations. So we are sticking to the most common and easily accessible deltoid muscle for the injection site. The deltoid muscle is located about 2 to 3 finger widths down from the acromion process, aka the bone at the tip of your shoulder that is on top of where your arm begins. There are ligaments and more bone in that area, so be sure to aim 2 to 3 finger widths lower for the deltoid muscle. The deltoid muscle is a triangular shape, so it is helpful to visualize an upside down triangle to map the injection site. Try to aim for the thickest part of the muscle. It is best practice to clean the injection site with an alcohol swab. Visualize where you will inject and take some calming breaths. Then uncap the needle and keep the client's arm steady as you inject the medication. IM medications are typically given at a 90-degree angle. So just keep it straight and parallel to the floor as you put the needle in. Additionally, most people do not need the full 1-inch needle into their arm to adequately reach muscle, and so the needle only needs to be inserted about 2/3 of the way in. Again, the needle is very sharp, so you don't need a lot of force for it to go in the muscle. Now, this needle has a safety feature that allows you to lock up the needle after use. Usually, you can slide it backwards across a flat surface and the locking feature will engage. But my towel kept moving, so I had to engage it with a simple flip. Once the injection is complete, dispose of the needle in the sharps container. Now I will repeat the process with my preferred method of using a cannula needle to reconstitute the med. Most people are only supplied with needles and syringes through their pharmacy, and so I started with that demonstration. However, the wide gauge of the cannula needle just makes reconstituting meds easier, and it reduces the risk of contaminating the IM needle or accidentally poking yourself. The cannula needle is blunt, so you do gotta use a little bit of force to get it into the vial. But once the med is reconstituted and you pull 1 milliliter into the syringe, you can just twist off the cannula needle and twist on the IM needle. another look on how to engage the safety cap on the needle. As with any PRN medication, documentation is a vital part of administration. So, why was the medication administered? Or, if you prepare the medication but didn't give it, document the client's behavior and what happened. For meds like Zyprexa that take a bit of time to prepare, I would rather it be ready and not used than to have you scramble to mix the med once the client is already posing a safety risk. Still, a record of all medications is required. Additionally, if agitation becomes more frequent, it is helpful to have it documented so we can show the client's doctor that perhaps some scheduled meds need to be tweaked to keep the client safe and comfortable. So, what signs of agitations were observed? Also, be prepared to document if the medication was effective, even if that means that you write something as simple as client went back to bed and rested easy for the night. What time did you give the medication? This helps us to keep track how long it takes for the medication to be effective. Also, note if there are any side effects, such as a dry mouth, and if they get really drowsy quickly, be prepared to care for them as a greater fall risk. This concludes the home health education for intramuscular medication administration. Please contact me, the registered nurse, with any questions, concerns, and whenever you administer a PRN medication. My phone number can be found in the front of the MAR. Thank you.